Amblyopia, lazy eye, is an ophthalmologic disease condition. Look at this picture, shows that normal eye, amblyopic eye. Look at this. Then structural abnormalities in visual path. Look at this. A detail going on. Introduction. Amblyopia commonly refers to as lazy eye is a vision development disorder in which an eye fails to achieve normal visual acuity even with prescription eyeglasses or contact lenses. Definition. Amblyopia is a neurodevelopmental disorder of the visual system characterized by reduced vision in one or both eyes that is not correctable by glass or lenses and is not due to any structural abnormality of the eye. It occurs when the brain and the affected eye are not working together properly, causing the brain to favor the other stronger eye. Etymology. The term amblyopia originates from the Greek word amblyos, meaning dull, or blunt, and opious, meaning eye or vision. Together it refers to dull vision, highlighting the reduced visual acuity characteristic of the condition. Epidemiology. Amblyopia affects approximately 2 to 4% of children worldwide, making it the most common cause of visual impairment in one eye among children. Early detection and treatment are crucial, as untreated amblyopia can lead to permanent vision loss in the affected eye. Types 1. Strabismic amblyopia, caused by misalignment of the eyes, leading the brain to ignore input from the misaligned eye. 2. Refractive amblyopia, caused by unequal refractive errors in both eyes or high refractive error in both eyes, causing the brain to rely on the clearer eye. 3. Deprivation amblyopia caused by obstruction of vision, example congenital cataract, that prevents clear visual input during early development. 4. Meridional amblyopia related to uncorrected astigmatism leading to blurred lens in one direction, affecting image formation and brain processing. Causes: 1. Strabismus, crossed or turned eyes. 2. Unequal refractive error, myopia, hyperopia, astigmatism. 3. Vision deprivation, example congenital cataracts. 4. Ptosis, dropping eyelids. 5. Eye trauma or surgery during early childhood. 6. Corneal apophysitis or retinal diseases is rare. Risk factors: 1. Family history of amblyopia. Strabismus or childhood cataract. 2. Premature birth or low birth weight. 3. Developmental delays. 4. Refractive errors are not corrected early. 5. Congenital eye abnormalities. Complications: 1. Permanent vision loss in the affected eye. 2. Depth perception impairment. 3. Strabismus if untreated. 4. Reduced academic or motor performance in children. 5. Psychosocial and emotional issues due to poor vision. Pathophysiology. Pathophysiology of amblyopia step-by-step process. 1. Disruption of normal visual input. One eye receive blurred, distorted or no image due to conditions like strabismus, refractive error or cataract. 2. Unequal stimulation of the retina. The brain receives a clear image from the stronger eyes and poor quality image from the weaker eye. 3. Suppression of weaker eye input by the brain to avoid confusion or double vision. The brain begins to ignore or suppresses signals from the weaker eye. 4. Neural development impairment. During the critical period of visual development, birth to around 7 to 8 years, The suppressed eyes neural pathways fail to develop properly. 5. Functional disconnection. The connection between the retina of the weaker eye and the visual cortex become underdeveloped or inactive, reducing its ability to process visual information. 6. Permanent visual deficit. If untreated, continued suppression leads to persistent visual impairment where the affected eye cannot be clearly even with corrective lenses. Note: the severity of amblyopia depends on the duration and timing of the visual disruption. Early intervention is essential to prevent permanent damage. Signs and symptoms: 1. Reduced vision in one or both eyes. 2. Poor depth perception. 3. Eyes that turn in or out. 4. Favoring one eye. Shutting one eye. 5. Head tilting or turning to see better. 6. Frequent eye rubbing or blinking. 7. Difficulty with reading, coordination or visual task. Diagnosis: A. Ophthalmologic evaluation. 1. Visual acuity testing. 2. Retinoscopy or autorefraction. 3. Ocular alignment test. 4. Slit lamp and fundus examination. 5. Cycloplegic refraction. B. Additional test: B scan ultrasonography. 2. Visual evoked potentials for unclear causes. Nursing diagnosis: 1. Educate patients on the importance of adherence to therapy, patching, medications. 2. Monitor visual acuity regularly. 3. Provide emotional support to children undergoing treatment. 4. Encourage participation in visual exercises or therapy. 5. Promote safe environment due to poor depth perception. Medical management: 1. Corrective eye wear, prescribing glasses or contact lens to correct refractive errors. 2. Patching, covering the stronger eye to force use of the amblyopic eye. 3. Atropine drops blurring vision in the stronger eye to encourage use of the weaker eye. 4. Surgery indicated for strabismus or removal of visual obstructions like cataracts or ptosis. Nursing management 1. Educate patient on the importance of adherence to therapy. 2. Monitor visual acuity regularly. 3. Provide emotional support to children undergoing treatment. 4. Encourage participation in visual exercises or therapy. 5. Promote safe environment due to poor depth perception. Treatment options 1. Glasses or cataract lens correct refractive errors. 2. Patching therapy, daily patching of the dominant eye for several hours. 3. Pharmacological penalization, use of atropine in the better eye. 4. Vision therapy exercise, eye hand coordination and focusing activities. 5. Surgical intervention, correction of strabismus, removal of cataract, etc. Psychosocial medicine 1. Family counseling and education, helping families understand the condition and reinforce treatment compliance. 2. Play therapy, encourage visual exercises through play to improve visual stimulation in children. 3. Support groups, connecting with other parents and children experiencing amblyopia. 4. Cognitive behavioral techniques, addressing anxiety, self-esteem issues and promoting adaptive behavior. 5. School-based interventions, educating teachers and modifying classroom strategies to accommodate visual limitations. Prevention 1. Routine vision screening in infants and preschool aged children. 2. Early treatment of refractive errors, cataract or strabismus. 3. Prompt management of any visual deprivation condition for educating parents on signs of visual issues. 5. Regular follow-up with pediatric ophthalmologist. In conclusion, amblyopia, though a leading cause of vision loss in children, is highly treatable if detected early through comprehensive screening, prompt corrective surgeries, and consistent therapy. Most children can regain significant visual function. Multidisciplinary management, incorporating medical, nursing, and psychosocial support, ensures the best possible outcomes. Education and awareness remain vital components in preventing lifelong vision deficits associated with amblyopia. Thank you. Have a nice day.